Bismillahirrahmanirrahim. In the name of Allah, the most merciful and gracious. I am grateful to the AOC and our management for inviting me to present viewpoint from Pakistan experience of COVID-19 and neuro rehabilitation sciences. I am Professor Dr. Muhammad Naveed Babar. I have done PhD in rehabilitation sciences and fellowship in neuro rehabilitation sciences from Seoul National University, South Korea. Currently, I am working as a Dean Faculty of Allied Medical Sciences, Principal Isra Institute of Rehabilitation Sciences, and Secretary General Pakistan Society of Neuro Rehabilitation Sciences. Severe acute respiratory syndrome, more commonly known as COVID-19, has caused devastation throughout the world since its first discovery in December 2019. Since then, this historical pandemic has spread across the globe, wreaking havoc and affecting all countries alike. The World Health Organization has classified the coronavirus epidemic as a global public health emergency of international concern. Like other countries, Pakistan has also been severely affected by this pandemic, and since report of first in late February 2020, the cases have been continuously on the rise. Following this, there was a significant surge in positivity due to influx of infected pilgrims from Iran. In addition to this, only within 15 days of report of first case of the cases plummeted to 202 infected patients. Such situation was expected considering the low literacy rate, general lack of awareness regarding COVID leading to non-serious behavior of people towards the adoption of social distancing, hand hygiene and other COVID SOPs. Like other middle income countries, Pakistan has scarce high-end medical facilities and have inadequate health strategies. This along with high population density in major cities with public having unresponsive attitude towards general protective measures contributed to increase in number of cases. Since February 2020, Pakistan is continuously struggling to flatten the curve but has seen three waves of COVID-19 and now preparing for Delta wave. The government has been trying its best to tackle this challenge considering all ways of life of prevent any major setback with major focus on healthcare provision. The country minister and chair of National Command and Operation Center managing all related issues, and the minister said the target is to prevent healthcare system from getting choked beside reducing hunger, poverty, unemployment due to COVID-19. For the said purposes, number of steps have been taken, including complete lockdown on March 23rd, 2020, including closure of all educational institutions, recreational centers, wedding hall, and shrines, etc. However, the struggling economy of the country forced the government to lift the lockdown on May 19, 2020, as COVID significantly impacted country's economy as evident from the fact that national poverty rate increased by 33% per point during the lockdown and closure of the different sectors resulted in drop in GDP and loss of 1.3 trillion to country's economy. The country's focus shifted from complete lockdown to selective smart lockdown of hotspots with relation to infection rate. Current stats show that since February 2020, Pakistan has seen over 1.03 million confirmed cases of COVID-19 with currently having over 70,000 active cases. Majority of the cases being reported are from Sindh and Punjab, two provinces with major population chunk. COVID-19 posed unprecedented challenges to states and communities across the globe. Like in many other countries, the health sector in Pakistan has put in massive efforts to control the spread of this pandemic in Pakistan and to care of the ill presenting in any health setting. The pandemic has put healthcare professionals working in ER, ICU, laboratories, and other departments in an unprecedented situation with difficult decision options and intense pressure for maneuver. This significantly impacted the healthcare system, resulting in hindrance to elective healthcare services, limited patient access to accident and emergency departments, Changes in patient administration systems such as shift to telephone consultation instead of face-to-face consultation resulting in surge towards the use of telemedicine, increased need for multidisciplinary team collaboration to manage COVID patients, need for increased healthcare capacity including increase in intensive care units, beds, staff and supplies such as PPE, masks, ventilators, etc. Special emphasis being put on physical and psychological pressure in healthcare workers in Pakistan due high risk of infection, inadequate equipment for safety from contagious isolation, exhaustion, and lack of contact with the family. Similar to all aspects of healthcare, rehabilitation care, especially neurorehabilitation, has also been impacted due to COVID 19. COVID 19 has increased the need of rehabilitation services in intensive care, rehab, and for patients with most COVID long term complications. For such purpose, in countries like Pakistan, where health facilities had limited capacity, special measures were taken for conversion of different departmental wards into COVID 19 isolation units, high dependency units, and IC units to have more bed for COVID patients to cater for increasing patient inflow. In addition to this, to ensure the care of patients affected by other medical conditions whose admission cannot be postponed, numerous inpatient beds of neurological rehabilitation were converted to COVID beds and inpatient neurorehabilitation services were halted. This resulted in disruption of care for non-COVID patients requiring continuous support and care such as stroke patient, spinal cord injury patient, children with cerebral palsy and elderly, etc. for some time, but was somewhat catered for by provision of tele-rehabilitation services, home health services, and outpatient services. Similar to this, at some places, specialized rehabilitation hospitals were also converted to COVID hospital and isolation centers. This is evident from the fact that the country's largest dedicated tertiary care physical rehabilitation hospital with more than 100 bed facility providing a range of comprehensive and multidisciplinary services to people with disabilities was converted to 130 bedded quarantine and isolation facility. Severe acute respiratory syndrome, more commonly known as COVID 19, has caused devastation throughout the world since its first discovery in December 2019. Since then, this historical pandemic has spread across the globe, wreaking havoc and affecting all countries alike. The World Health Organization, while some facilities were completely shut down, access to others was difficult. To curb the increasing number of cases, the government instituted suspension of all trains and inter-district passenger transit, including urban passenger transit. This was in addition to imposition of ban on movement of elderly children, people with health issues, considering the fact that almost 70% of the country population live in the peripheries, the individual with specialized neurorehabilitation needs were unable to access the care due to difficult of, in some cases, complete lack of any transportation. Similarly, to people, neurorehabilitation professionals also face difficulty accessing patient receiving care in home-based setting, considering the restriction imposed by the healthcare authorities in the movement of people to prevent the spreading of the infection. The situation had a significant negative impact in the short term, mainly for those patients at high risk of deterioration of their functional ability due to lack of rehabilitation care. In addition to this, physical distancing and isolation measures implied the suspension of physiotherapy services, which impacted negatively on the patient quality of life and health and impaired physiotherapists' ability to manage the continuum of care for patients with chronic neurological conditions such as stroke, spinal cord injuries, and Parkinson's. COVID 19 also resulted in reappropriation of not only physical resources but also human resources from specialized neurorehabilitation unit to intensive care unit to care for COVID 19 patients. This predominantly due to significant patient intake of COVID, but also due to non-availability of the staff as a result of COVID infection or isolation. In addition to this, manpower from orthotics and prosthetic sector was also shifted from developing orthotic and prosthetic to development and production of masks and PPE to cater for the limited supply and increased demand of masks and PPEs. This resulted in significant delay in development of orthoses and prostheses from neurorehabilitation patients requiring some form of support orthotics. Physical and mental health of the work staff and health professional was also one of the issues faced during the recent COVID-19 pandemic situation. Long working hours with increased physical work demand resulted in health professionals with significant physical and mental exhaustion and fatigue. Mental health was further challenged in by addition emotional challenges due to managed COVID-19 patient not having contact with family members due to risk of virus transmission, fear of infection and transmission. This emotional stress was in addition to stress resulting from witnessing deaths of COVID-19 patients and forced self-isolation and monitoring at home as a result of suspected infection. All these highlighted the need for mental health care for rehab and health professionals. While significant challenges were identified, some opportunities also raised in wake of COVID-19. The country lacks significant barriers to tele-rehabilitation and rehabilitation with lack of infrastructure, internet access, awareness. COVID-19 promoted the incorporation of tele-rehabilitation services to tackle the issues of limited access arising suspension or delay in outpatient services, ceased home-based services, lack of access to healthcare facilities. In addition to this, having better telehealth services in third world countries, international hospitals offered aid in form of free online multidisciplinary rehabilitation program, consultation and online health scans, and tailored treatment regime for patients in Pakistan. COVID also provided opportunity for health professionals to upskilling rehab care services provided to the patient under infectious control protocol. For such professionals were provided training related to the barrier protocol and effective and judicious use of PPE and provision of rehab care to COVID-19 patients. All in all, COVID-19 is far from over in Pakistan, and future policies and reforms can be carried out considering all aspects of neurological rehabilitation care and current situation of COVID-19 in Pakistan. I am grateful to Dr. Muhammad Ihab Azam, Senior Lecturer, Foundation University, Islamabad, and a PhD scholar, ISRA University, Islamabad campus, for retrieving the data for this current topic. Thank you very much for listening. Viewpoint from Pakistan for Neuro Rehabilitation Sciences. Once again, thank you very much for AOC and our management for inviting me to present Viewpoint from Pakistan. Thank you very much.